Hello, my name is Ivy. I'm a fourth-year social work student at Toronto Metropolitan University. I'm currently completing my placement with Organization for a Safer Space. Today, I will be talking about Attention Deficit Hyperactivity Disorder, or ADHD. In this video, we'll first look at what ADHD is. We'll then look at some statistics, risk factors and causes, symptoms, effects, treatment, and lastly, we'll look at some coping strategies. Attention Deficit Hyperactivity Disorder, or ADHD, is one of the most common neurodevelopmental disorders in children. ADHD is characterized by continuing patterns of inattention and/or hyperactivity, impulsivity, as well as difficulty following instructions and completing tasks. These patterns interfere with daily functioning and development. ADHD behaviors typically appear by the age of 7, and it can continue into adulthood for almost half of the cases. Statistics. Approximately 11% of children between 4 and 17 years old have ADHD. ADHD is 3 times more common in boys than girls. Approximately 4% of American adults exhibit ADHD behaviors daily. ADHD is equally diagnosed in adult males and females. Risk factors. ADHD is a hereditary mental health condition. Children are more likely to have ADHD if one or both parents have ADHD as well. There are certain groups that are more likely to develop ADHD, such as people with premature birth or low birth weight, alcohol and tobacco use during pregnancy, exposure to environmental risks such as lead during pregnancy or the early years, people with lower levels of neurotransmitters, which are brain chemicals that help to control behavior, including dopamine, people with epilepsy, and people with brain injuries. Symptoms. It is normal for children to have difficulty focusing and behaving. However, the symptoms for children with ADHD continue to be severe and create problems at school and home. There are 3 ways that ADHD presents itself. The first way is predominantly inattentive presentation. The symptoms for this include having a short attention span and being distracted easily, making careless mistakes in schoolwork, for example, forgetfulness, someone who often loses things, difficulty to continue tedious or time-consuming tasks, difficulty listening or carrying out instructions, changing activities or tasks constantly, and difficulty organizing tasks. The second way ADHD presents itself is predominantly hyperactive, impulsive presentation. The symptoms for this include difficulty sitting still, especially in calm settings, fidgeting and squirming, often leaving a seat when asked to sit still, difficulty concentrating on tasks, excessive physical movement, often running or climbing, excessive talking, difficulty waiting for a turn, acts without thinking, often interrupts conversations, and having little or no sense of danger. The third way ADHD presents itself is a combined presentation of the 2 previously mentioned types. The inattentive and hyperactive symptoms are equally present in a person. Effects. If left untreated, ADHD can affect one's school, work, and relationships. The effects of ADHD include difficulty bonding with others, social isolation, decreased performance at school and/or work, dropping out of school, increased risk-taking behaviors, and increased risk for accidental injuries. Treatment. There are different types of treatments for ADHD. Psychoeducation encourages people with ADHD to understand their diagnosis, learn about its effects, as well as coping strategies. Behavioral therapy can help a person change their behaviors. Behavioral therapy can involve practical help, such as organizing and completing tasks, learning how to monitor one's own behaviors, and using praise and rewards for desired actions, such as thinking before acting. Cognitive behavioral therapy can help a person manage their problems by changing their thoughts and feelings to improve their behaviors, including their focus and concentration. Family and marital therapy can help family members and partners develop methods to handle disruptive behaviors, inspire behavioral changes, and enhance social interactions with the person with ADHD. Social skills training includes role-playing situations to learn how to behave appropriately in social situations and learning how one's behavior affects other people. Parent training and education programs can educate parents on how to communicate, play, and work with their child to improve their attention and behaviors. Medications may also be prescribed by a healthcare professional. Stimulants are the most common medications for ADHD. Stimulants increase dopamine and norepinephrine, which are brain chemicals involved in thinking and attention. Non-stimulants can improve focus, attention, and impulsivity. Coping strategies. There are several ways to cope with ADHD. A person with ADHD or parents of a child with ADHD can help to do the following. Create a routine by following the same daily schedule. Organize belongings, such as placing clothing, toys, or bags in the same place daily to reduce the chance of losing their belongings. Plan by breaking larger tasks into simpler ones, which can involve taking breaks as well to reduce stress. Writing lists, using a calendar, and setting reminders can also be beneficial. Reduce distractions by limiting TV watching, noise, and having a clean workspace to do homework or work. Reduce choices. Having limited choices can help to prevent overwhelm and overstimulation. Use goals and rewards. Having realistic goals for positive behaviors and using rewards for one's efforts can be beneficial. Create positive experiences by engaging in activities one does well, such as school, sports, music, arts, or play. Creating a healthy lifestyle by engaging in physical activity, eating healthy, getting adequate sleep to prevent symptoms from worsening. Feel free to check out the Organization for a Safer Space at forsaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.